Radiography is concerned with the recording of an image produced by the transmission of X-rays through the body, using either a film screen system or a digital recording device. Fluoroscopy is also concerned with the X-rays transmission images, but instead of recording a single frame, a sequence of images is viewed in real time. Direct viewing fluoroscopy involved the use of zinc sulfide fluorescent screens. The phosphor was backed by lead glass, and the radiologist viewed the image from behind the screens while being shielded from the radiation transmitted through the patient and phosphor. In the late 1890s, Thomas Edison began investing materials for ability to fluoresce, and by the turn of century he had invented a fluoroscope with sufficient image intensity to be commercialized. Fluoroscopy is a study of moving body structures similar to an X-ray movie. A continuous ray beam is passed through the body part being examined. The beam is transmitted to a TV-like monitor so that the body part and its motion can be seen in detail. Fluoroscopy, as an imaging tool, enables physicians to look at many body systems, including the skeletal, digestive, urinary, respiratory, and reproductive systems. Fluoroscopy is a type of medical imaging that shows a continuous X-ray image on a monitor, much like an X-ray movie. During a fluoroscopy procedure, an X-ray beam is passed through the body. The image is transmitted to a monitor so the movement of a body part or of an instrument or contrast agent through the body can be seen in detail. Fluoroscopy carries some risks, as do other X-ray procedures. The radiation dose the patient receives varies depending on the individual procedure. Fluoroscopy can result in relatively high radiation doses, especially for complex interventional procedures, such as placing stents or other devices inside the body, which require fluoroscopy be administered for a long period of time. The probability that a person will experience these effects from a fluoroscopic procedure is statistically very small. Therefore, if the procedure is medically needed, the radiation risks are outweighed by the benefit to the patient. In fact, the radiation risk is usually far less than other risks not associated with radiation. To minimize the radiation risk, fluoroscopy should always be performed with the lowest acceptable exposure for the shortest time necessary. Here is an example of how a fluoroscopy scan is operated. Also, here is a live video displaying a fluoroscopy scan of a person eating and drinking from the TV monitor point of view. Fluoroscopy has evolved from the most simplistic of non-invasive imaging methods to a very sophisticated technology with advanced 3D capabilities, able to guide life-saving interventional procedures often with minimal patient discomfort. Many of these minimally invasive image-guided procedures have replaced highly invasive open surgical procedures. With each incremental advancement in the technology, smaller vessels and more subtle contrast differences can be visualized in real time, often with low radiation dose.